All right, we're bringing you full coverage of World AIDS Day today. President Cyril Ramaphosa says South Africa has made great strides in dealing with HIV/AIDS, but he says COVID-19 has put the health system under pressure, affecting those living with HIV. South Africa, remember, has the largest population of people living with AIDS in the world, and to date, around 4 million people have died. To discuss, we're joined now by the Chairperson of the Treatment Action Campaign, Sibongile Tshabalala. Thank you for being with us. I've been a journalist long enough to remember the days when South Africa was resisting handing out ARVs. We have indeed come a long way, but where would you say we are in a fight for a country actually to be free of this scourge?
Yes, we have come a long way, because now, from the early days that you're talking about up to now, at least now we have treatment being rolled out in almost every facility in the country. However, while we have strived so much and we have successful stories to tell about HIV rollout in the country, we still have challenges that we are still facing as people living with HIV, and those challenges are dragging the progress that we have made so far.
Tell us about those challenges.
The challenges that we are talking about, it's ongoing drug stockouts, which are ARV stockouts that we continue to experience now and again in our public sector. And as I'm talking to you now, Northwest has a challenge of drug stockouts that has been continuing for over 2 years now. And we've been taken from pillar to post to get answers to say what is wrong, what has happened. During lockdown, we have seen a disrespectful behavior towards people living with HIV when they were collecting their medication. They couldn't access their medication. One, because the facility it's been closed due to being the staff being infected with COVID-19, and patients will be taken from pillar to post without a clear direction to say where can they access their treatment. Also, we have experienced patients being given their medication over the fence, of which that is so inhumane and disrespectful. We understand that COVID-19 regulations were needed to be followed, but nobody should be given a medication over the fence. A patient had to ask securities over the fence to come and collect their medication at the pill box that is provided. And also at some point we experienced patients being given counted pills, which 5 to 10 pills wrapped in a tissue paper. That is so disrespectful and it's inhumane. And also we are still facing the stigma and discrimination when you go to facility where your card as a person living with HIV will be different from other people's card. And also sometimes you'll be announced to say those who are here for ARVs or those who are here for viral load, they should sit this side. So that is stigma and discrimination, which makes more people not to go to facilities. And when you miss your date at a facility, you are made to be on the last in the queue, even though you are not here to see the doctor or you are not here to consult, only you need your medication and be taken out. We have been introduced to CCMT sites, but then people have been going to CCMT sites and they are not getting their medication. They've been sent back to the facility. When they get to the facility says, no, your medication, it's been transported to the CCMT side. So those are the challenges that people living with HIV still are facing at this time and age.
How much of this is due to COVID-19? There was a huge concern, and you said that people going for treatment faced huge challenges, that clinics would be closed or hard to access ARVs when COVID-19 was in focus. Is it possible to tell how many people haven't been taking their medication because of what's been happening during the lockdown?
For now, we don't have exact numbers, but when you go to other provinces, like for instance in Gauteng, I think it was around June when the Gauteng announced that already we have lost 11,000 people on treatment. So you can ask yourself to say from then till now, how many people we've been lost. And when you go to facilities also, you get back bits and pieces of information to say we've been lost them to follow to care. So yes, although now we don't have exact numbers, but yes, I think it's a number of people that we have lost in treatment. And due to COVID-19 also, remember, other people didn't succeed or didn't survive. They were infected, but our system cannot track those people. So the systems that we have, the filing system, it's not talking to each other, because if a person takes medication or is treated on the other facility, it's difficult to measure, to say this person is still alive or not. So our stats are not yet telling us the exact figures to say how many people who have lost to follow up.
Yeah. And finally, you spoke about the stigma, the different cards for people who have HIV or AIDS going to a clinic. We've heard even from government concerns about nurses that give young people a hard time, scold them about their status when they come and receive medication. My question to you is, at least are things getting better in that regard over time?
Unfortunately, I cannot say much. Yes, government is trying to employ young nurses so that when they go to facilities and they can be young people, they can be taken care of. But we haven't seen much change onto that. What we feel as people living with HIV and young people today at the dialogue with the president, they express their feelings to say they feel like they are not being taken care of because they are facing so many challenges. It's difficult for them to go to facilities because when they go to facilities, they have to queue with all the old people who don't understand why a young person is HIV positive. And it seems like we have forgotten where we come from as a country to say in the early years of HIV, the young ones who were born between 1993, 98, 95, 2000 until 2004. Those people, most of them, they were not, the mother-to-child transmission program was not there, the prevention method of it. So most of the children there were born with HIV, and now they are teenagers or they are young adults. So those young ones are not, the system doesn't talk to them. There are no programs that talks to them to say, how do we sustain them to care? How do we keep them to care? How do we support them psychologically? How is the country giving them psychosocial support? Because most of them, they've lost their parents. They were living with their grandparents. Some of them, they've lost their grandparents also. So they are left vulnerable without any support, without any systems that are giving them support. So they are left alone there outside. So there is not much that it's happening or assisting young people living with HIV.
Yeah. All right, huge challenges still for people living with HIV and AIDS, and we'll continue with this discussion. That was the chairperson of the Treatment Action Campaign, Sibongile Tshabalala.